Hi, this is Dr. Kevin Tomassini from Spinal Performance at Core Collective, and today I'm with a very special guest. She's a doctor in educational leadership and has a master in child development, and she's my wife, Dr. Cruz.
Hi everyone.
Okay, so today we're going to be talking about a very special issue that I see every single day when we go out is kids in laptops or iPads hunching down and not engaging with the world. What do you think about this?
Well, recent studies in education and psychology has shown that prolonged exposure in children to electronic devices conduces to negative effects. So some of the things that we know happen when you have your children sitting down for a long time in an iPad or in a cell phone is there are changes in their brain cortex. There's a significant decrease in their academic performance, particularly in the areas of language development and problem-solving skills, in addition to issues with reading comprehension, which is an essential area for children to be successful in their academic careers.
In my case as a chiropractor, I see a lot of postural problems. Kids younger and younger hunching over. If they're hunching over the whole day, they're going to grow up like that. They're going to start to develop neck pain, low back issues, and joint issues. They're going to start to get overweight as well because they're not exercising enough, and they have a lot of sleep problems. When you're in your iPad or your laptop during the night or before you go to bed, your melatonin hormone, that is a sleep hormone, decreased by 40%. So you're not going to get this sleep, and this is going to affect them in school as well.
Mm-hmm.
Now, what are strategies that we can use, or parents can use, to get the kids off from the laptop or from the iPad?
Well, the first one is very obvious. It's just setting fixed times for using these devices. So children under the age of 2, according to the American Health Association, is not advised that they're exposed to electronic devices, period. This is a very critical age in child development. Children are all about exploring, curiosity, discovering the world, so it is not advisable to have the children sitting down passively with a device. In children of school age, we have to keep in mind that most schools now expose children to electronic devices in itself. Although it's more controlled, they're still being exposed. So at home, it is not advisable that they are exposed more than an hour per day. The studies that show that there are issues with reading comprehension and academic performance are about children that are exposed up to 35 hours a week.
And that's more.
So, and unfortunately, there are a lot of children that spend that amount of time in electronic devices, so we have to be mindful of that. Things that parents can do. So sparking children's interest, whether it is in the arts, music, sports, just getting them to do activities that are off the devices. In addition to that, if they are going to be using the devices, adult engagement is crucial. So choosing apps or games that promote creative thinking or problem-solving skills is really important. But even more important is that the adult is part of that experience and that they're sitting down, they're having a conversation, and they're talking about what's going on a daily basis. Last but not least, role modeling. If you as an adult, children do what they see, right? Not what you tell them to do. So if you as an adult are spending hours and hours on your phone, on your tablets, on your laptop, and children are seeing that, it's going to be really hard to tell them not to do the same. So role modeling, I would say, it's number one.
As a chiropractor, I will definitely recommend that they are doing sports outside, that they're playing in the dirt, they're playing in the sun, they're playing in the water, so they use their muscles, they use their joints, and they're not just hunching like that. That will definitely help them in their conditioning, in their movement, and their cognitive abilities as well. So we're going to be recording a lot of these videos now with Dr. Cruz and Dr. Kevin Tomassini, so stay tuned.
Bye guys.